One of the top questions I get when people come in for a consultation about eyelid surgery is, am I going to have a scar? And people will point to their legs or arms, and I've got some scars here on my elbow from playing lacrosse, and they think that that must mean that they just scar badly. And I have to tell them that it doesn't matter. Eyelid surgery scarring is different. And if you stay tuned until the end of this video, I'll tell you why. My name is Dr. Kian Eftekhari. If you're new to our channel, I'm an oculofacial plastic surgeon who specializes in eyelid surgery. If you'd like to learn more about other types of eyelid surgery, please consider subscribing to our channel or comment below in this video. So scarring after eyelid surgery is just different. It doesn't matter if you have big scars on your knees or other parts of your body, because in general, other parts of our body, like our extremities, think of how long our arms and legs are relative to our torso and our face. Other parts of our body are farther away from the heart, they get less blood supply and blood flow, and they tend to heal not as well as you heal around the eyes. That's also why people bruise a lot after eyelid surgery, is because there's a lot of really good blood flow in that area. As long as you know what you're doing and you're a specialist in eyelid surgery, the chance of getting a permanent scar after eyelid surgery is minimal. And in this video, I'll kind of tell you top to bottom where the procedure scars will be for your surgery. So if we're talking about a forehead lift or a brow lift or a brow contouring procedure, usually those scars are going to be held behind the hairline. Now, this is an important thing to talk about. People say that they're going to get a scar after surgery. The reality is, anytime any surgeon makes any incision on your body, you will get formation of scar tissue. That is different from whether you have a noticeable scar. And the noticeable scars are the ones we care about. So when we put incisions behind the hairline, in most cases, you'll be able to feel a scar. And if you part your hair, you'll be able to see the scar even a few months after surgery, although with time, it does usually get better. The important thing is that when we hide them behind the hairline, other people won't be able to see the scar, so it's not noticeable. That's what we do for a forehead or a brow lift. For upper eyelid surgery, if I'm just removing extra skin, it's super important to know where to put the scar. Some surgeons put the scar a little too high, and then that can really be noticeable because it can kind of drag up the natural eyelid crease, and you have a second line in your eyelid. The eyelid crease is the key to hiding a scar from an upper eyelid surgery. So when somebody has hooding of the upper eyelid, as long as I start where I'm doing the surgery in their natural eyelid crease, in most cases it will heal in that spot so that the scar kind of looks like they have their normal crease there, and it just has a lot less skin on top of it. For upper eyelid ptosis surgery, which is to fix the droopy eyelid when somebody looks like they're kind of half winking, tightens the muscle of the eyelid, 95% of the time I don't even need to make an incision on the skin. I flip the eyelid inside out, I work on the muscle from the back side of that tissue, and you won't even see any stitches after surgery. For the lower eyelids, people are often wanting to have bags removed under the eyes or a tightening of the eyelid called a Kian Eftekhari. Most of the time for a lower eyelid bag surgery, if I'm removing or repositioning fat, I'm going to actually not make a visible incision on the skin. I'm going to go in that pocket right in there that you might be able to see where you have that pink tissue. That allows me direct access to the fat without making any incision on the skin. In general, if your surgeon tells you they want to make an incision straight in the center of your cheek, you might want to consider getting another opinion, unless it's something called a festoon, where we rarely do that kind of surgery. Most of the time for lower eyelid surgery, when we're removing bags, surgeons should be going behind the eyelid. That's the natural place to go. It doesn't leave any stitches or scars visible on the skin, and it just tends to give you better access to that area. Sometimes when I'm doing that procedure, I'm also doing something called a Kian Eftekhari. The way I do that surgery is I go at the corner of the eyelid, kind of where the upper and the lower eyelashes meet at the corner, and I design it in your natural smile line. So if you see I'm smiling, it crinkles up in that area in the corners there. And if you design an incision going upwards in that area, it heals beautifully, and you don't necessarily need to worry about a permanent scar because of the way we have certain tension lines in our skin that can help us hide scars. For fat grafting, that's just done as an injection, kind of like filler, so it tends to be the case that when I do fat grafting, there's not a visible sign of it afterwards. Now, sometimes you can have a visible scar after eyelid surgery. It happens to the best of us, and sometimes it happens because the surgeon wasn't being very careful and goes under the eyelashes to do your lower eyelid surgery and then swoops on over and down. I've seen that in my practice. It doesn't necessarily look the way we want it to, the way you are hoping for at the end. And so I would ask you to ask your surgeon where they're going to put the incisions, because that's going to determine the type of scar you get. In general, around the eyelids, scars are going to be favorable, and you don't have to worry about that, even if you have a big one on your elbow like I do. If you'd like to learn more about eyelid surgery, please consider subscribing to our channel or comment below, or check out our website, eyelidcenterutah.com.